Well, let's give you an update then on the COVID situation in the country then. 1,050 new cases of COVID-19 have been reported in South Africa. This places the positivity rate at 5.9%. The National Health Department has also recorded 5 new COVID-19 related deaths. A further 7 deaths have been added to the death toll due to an ongoing audit exercise to address a backlog of COVID-19 mortality. Active cases stand at 13,409. Well, High Health says that it supports and welcomes national policy which is rooted in the latest science and notes the call from the Health Minister, Dr. Phaahla, on the eased approach to wearing of face masks. The Minister made the announcement in a media briefing yesterday. The regulations include wearing of face masks, social gatherings and checks at South African borders. For more, we're joined via Zoom by Professor Ramneek Ahluwalia, who's a director and head of higher education HIV/AIDS program. Prof, always a pleasure to have you on the show. Thank you as always for agreeing to speak to us.
Hello, Flo, and hello to everyone, and good afternoon.
Good afternoon, sir. Let's talk about then your reaction then to the relaxation of the regulations. I mean, not so long ago we're starting to have concerns about a different wave, but then we hear the opposite, that the regulations will be relaxed. Some people not in fact excited about it, saying there's a new kid on the block being monkeypox. Of course, that not transmitted in the same way, but some opting to keep their masks on. What does this all then mean, and what is your reaction to it?
No, I think South Africa, or I would say the global world, and what the science has now seen is what we haven't seen this year so far is another variant of concern that has the power to displace the existing Omicron variant. And we know a lot now about this Omicron variant. Secondly, despite the 4th wave or the 5th wave that just recently happened, or the Omicron variant or its subvariants, the death rates remained extremely low, or the severity of the infection remained extremely low, where the virulence of the virus has tamed down what we have seen. The incidence rates have gone down. As much as you're reporting 1,050 cases a day, which is still an alarming number, this is from the number of people who are testing, and we have also seen that the number of people who have testing have also gone down. The death rates and the severity of the infection has given empowerment to many governments, including South Africa, to now start considering what we call it as, let's remove the mask mandate, or let's relax our protocols on COVID-19 to as low as possible and keep our economy running as fast as possible. And I think that's a correct decision as per to what we have not seen from what we were expecting on COVID. And exactly last year, what we were seeing, the 3rd wave or a Delta variant or a very high virulent variant coming, and then a high transmissible like Omicron. So we've not seen COVID really giving us a surprise of a new variant of concern, which has really empowered us. And the most important part that we have to still consider is that COVID remains around us. We are in winter. And my advice will always be from the public health lenses, just in terms of not only COVID-19, but for good public health practice or influenza or other viruses that are very pronounced in winters, that when you are in a crowded place, when you are indoor, and when you are in a congregation, ventilation and masks still will hold your fort, not just only for COVID, but many other respiratory infections that are very possible during the winter season, which is prone for virus. So this is the advice that we can give. But good news, relaxation of masks, no severities for now, no variant of concern. So we respect what the minister said.
Yeah. Prof, you and I have discussed this quite a number of times, when it comes to higher learning and in high institutions, and, when it comes to lecturing, for instance. I think you made the example of the fact that, being a doctor and training doctors, you'd need to actually be present to see what is actually happening in the lecture hall. Do you think that you'll be suggesting then, or advising rather, that, institutions of higher learning, in fact, go back to 100% capacity, even if you have those rules? Maybe you'll say your students should still wear their masks. I mean, are you starting to think about that at this time?
Definitely yes. because the severity and the death rates have given us that much of empowerment that we can now focus a lot into the productivity as a nation, hope of those mothers where the children are waiting for the face-to-face contact learning. So yes, at this moment, we are going to be looking into in fact, we are consulting all the 26 public universities, all our TVET colleges, the entire post-school education for a full 100% capacity. But we're going to be putting up a word of caution to say, let's promote masks still if the congregation is too crowded or in lecture halls which have less ventilation scopes. There it is a high risk zone, not only for our productivity in terms of going down because of COVID spread, but equally because of also other viruses that are equally prone in the winter season. So just a good public health practice. But yes, full capacity, absolutely looking into it with the
and I mean,
the advent of new.
Yeah. Are we at this point, needing to worry or panic at all about monkeypox? I mean, in the beginning stages of COVID-19, we were asking these questions, whether we should start to worry. And then it became quite the problem. And one hopes this doesn't happen again when it comes to monkeypox. Are there any plans that, you're putting in place as a response in case it does become an issue for institutions?
See, it is definitely an issue. It's a huge outbreak. It's not a pandemic yet, but it's a huge outbreak. It has reached South Africa, which was bound to happen. It was moving quite aggressively into the global world. We have seen this mutations on this new variants of the monkeypox virus, which has been into human existence since 1958. However, as viruses mutate, seems like this variant has formed a human-to-human transmission, sexually transmitted way. Develops vesicles on the body like a pox, which spreads through fluid. So these are all the public health measures. It's not a respiratory infection, so it's not as much as the COVID-19. So different protocols needs to be now reinstated. Need to look at contact learning. We are an institution where we are a place where we have congregations, we have hostels, we have residences, we have people living together. And that's where the spread of the infection is quite close. So I think we need to be extremely vigilant. And what we're going to be starting on is a whole process. What we did with COVID is capacity building on our frontline teams, on management teams, specifically our residences and our support service structures, in order for us to identify monkeypox quickly, isolate cases, ring fence, what we call it a ring fence vaccination, because for context, if we can ring vaccinate people very quickly, isolate people quickly, most of these infections are mild for now, and we can contain because it's still an outbreak. And I think due to the nature of what monkeypox virus seems to be right now and what we've seen from the global data, it is a containable outbreak. As far as possible, we can put our public health measures faster. And I think that's what we're going to be promoting into our institutions of higher learning. We need to be high alert at this moment because it's come to South Africa and we know it has the potential to spread.
All right, Prof. Ahluwalia, thank you as always. We appreciate your time. Professor Ramneek Ahluwalia is the Director and Head of Higher Education HIV and AIDS Program.